Next question. A 2-year-old boy presents to the pediatrician for evaluation of an elevated temperature, sore throat, runny nose, and lacrimation for the past week, and a rash which he developed yesterday. The rash began on the patient's face, spread down to the trunk, hands, and feet. The patient's mother gave him ibuprofen to control the fever. The child has not received mumps, measles, or the rubella vaccinations because he was ill when the vaccination was scheduled and was later lost to follow-up. Vitals are 90/50, blood pressure, heart rate 110, respiratory rate 22, temperature 100. On physical examination, the child was drowsy. His face, trunk, and extremities were covered in a maculopapular erythematous rash. 2 irregularly shaped red dots were also noted on the mucosa of the lower lip. The remainder of the physical examination is normal. What is the constipation? Okay, this one also very straightforward, simple, but once again, it keeps showing up. So let's go over this. The case demonstrates the clinical features of measles, which is a viral disease caused by the measles virus, which belongs to the morbillivirus genus. Measles has a maximum incubation period of 21 days, but symptoms usually start 10 to 12 days after exposure to the virus. The disease starts with a prodromal period, which lasts 4 to 5 days. Morbillivirus is one of the main considerations in the differential diagnosis of a pediatric exanthem. So whenever you see a child coming in with a rash, this is number 1 on your list of differentials, along with a list of other things which we will go over. So the prodromal symptoms are easy to remember if you remember the 4 Ds and the 3 Cs. So the 4 Ds stands for 4 days of fever. The 3 Cs, I'm sure as you all know by now, is cough, coryza, which is head cold, fever, sneezing, and conjunctivitis. So cough, coryza, and conjunctivitis and 4 days of fever would be the prodromal symptoms. Fever is usually high. It can be as high as 104. There's something called Koplik spots, which are an enanthem. Enanthem is basically an internal rash, and exanthem is an external rash. So an enanthem, which is eruption of the mucous membranes, which is considered to be specific measles symptoms that appears 2 to 3 days before the rash and persists 1 to 2 days after the rash erupts. There are white or red spots, sometimes with signs of necrotization seen inside the mouth, usually on the lower lip or buccal mucosa, opposite the lower first and second molar. So this is how they characteristically describe it in questions, and this is how it's seen as well in patients. So the rash in measles can be described as an erythematous maculopapular rash, begins on the face, spreads to the trunk and extremities, so that by the 3rd day, the entire body is involved. On day 5, the rash begins to resolve in the same order as it developed, beginning with the face and ending with the extremities, leaving desquamating spots which later disappear. An example, okay, so we saw that in the picture. Just a couple more points I want to go over just as memory aids really. So once again, we have gone over this before, but you need to know the difference between just the terms. Rubeola, which is measles, which we just went over. Rubella is also known as German measles, and roseola infantum is exanthem subitum. So these terms, do not get confused between them. And this kind of shows us the order of appearance and disappearance of the rash. So an easy way to remember it is just think of paint falling over a person. So it starts with the head and then it spreads down to the extremities and it disappears in the same order. And here, like we saw in the previous question, in the picture as well, you can see it's a maculopapular rash. And this picture is showing us the prodromal symptoms. So the 3 C's, conjunctivitis, cough, coryza, and high fever is associated with measles, 104 approximately. And here is the Koplik spots. Okay, so these are just round lesions on the mucous membrane opposite the molars. And it usually presents with a blue center and a red peripheral area. Okay, so just to kind of capsulate the findings again, prodrome, fever, malaise, anorexia, the 3 C's and the Koplik spots. The exanthem is blanching, it's reddish brown maculopapular. Once again, cephalocaudal, centrifugal spread, it spares the palms and soles. It's important to know that it spares the palms and soles because there are only 3 or 4 rashes which involve the palms and soles, which if you've read first aid, you must remember the mnemonic CARS, because you drive your car with your palms and your soles. So CAR stands for Coxiella A, rickettsia, and syphilis. So these are the only three, not Coxiella. Okay, I'm forgetting what it's called. Okay, it's a syphilis and rickettsia, and I will tell you what the third one is called. I'm forgetting what it's called. Diagnosis is by PCR and serology. Prevention is by vaccination. Treatment is supportive care and vitamin A for hospitalized children. And complications can be otitis media, pneumonia, neurologic, like encephalitis, acute disseminated encephalomyelitis, or the one that most commonly comes up in questions is subacute sclerosing panencephalitis and gastroenteritis. So these are some of the important things to remember about measles. Okay. Now coming to this table, this covers a whole lot of other diseases that can produce rashes. So measles we just went over, so I won't do it again. Scarlet fever, it's caused by Strep pyogenes. It causes a generalized erythema with a sandpaper-like texture. So that's the key word you need to remember. This begins on the face and upper part of the trunk and spreads inferiorly. And some of the key features to remember, I'd say, with scarlet fever is the strawberry tongue, exudative pharyngitis, and its association with rheumatic fever. Okay, rubella also causes a maculopapular rash, spreads inferiorly. It causes lymphadenopathy, especially posterior cervical chain lymphadenopathy. Arthralgias are very characteristic, especially if adults develop rubella. Erythema infectiosum, which is seen with parvovirus B19, the characteristic slapped cheek rash is seen, and the rash waxes and wanes over weeks. Once again, the characteristic arthritis, especially in adults, which is a rheumatoid arthritis like arthritis, and aplastic crisis, once again, very high yield to remember. Roseola is associated with febrile seizures. That would be the key thing to remember here. Varicella, herpes zoster. This is not a maculopapular rash, but a vesicular rash. So you see vesicles on an erythematous base. It's also known as dewdrops on a rose petals kind of rash. So that's just another way to remember it. This also begins on the face and trunk, spreads centripetally, associated with pruritus, and the Coxsackie. Sorry, that was the one I was trying to remember. So hand, foot, and mouth disease, Coxsackie A. This is the one that causes the palms and soles rash. Okay, so hand, foot, mouth disease it's obviously involves the mouth, hands, and feet, and vesicles on the hands and feet and in the mouth. So very high yield to know this table well and know some of the key features of each of these organisms.
Thanks for watching. Please give a thumbs up and subscribe for more.